Good afternoon, everybody, and welcome to the panel this afternoon. Today we're going to be discussing digital dentistry in practice and is the bounty worth the burden? I'd like to welcome everybody here and thank you so much for traveling and for being here with us today. And I'd like to first of all introduce the panel. We have Dr. Sinead McEnhill. She's the director from the Belmore Dental Clinic in Belfast, an Irish dentistry, and she's won a lot of awards and has been recognized for her great contribution to dentistry. And we have Dr. Uchenna Okoye, who's a prestigious graduate from Guy's Dental School, and she is the clinical director of London Smiling Dental Group and one of the elite dentists in a group from the AACD. She's also a member of the British Academy of Cosmetic Dentistry. Beyond running her own multidisciplinary practice, she has been on television. You may know her from the TV and from her frequent contribution as an expert on health panels as well, and multiple boards and magazines. So welcome, Uchenna. And we also have Dr. Alison Simpson, who graduated from Dundee University in 1997. From university, she went on to vocational training and joined the practice as a dental surgeon. And recently she has founded her own dental clinic in Rothwell in 2015, and she set up a new Scotch practice. So welcome, everybody. So we'd like to ask you some questions about digital dentistry. And first of all, how has the incorporation of digital dentistry worked in your practice?
Well, it has become quite a shock to find that this 1 year of experience in digital dentistry has just completely opened my mind in comparison to how we used to work. The fact that everything has just become so incredibly accurate, workflows have completely changed. We find that the staff themselves have just got a completely different view on the daily work that we do. And basically, in terms of accuracy, predictability, every aspect of digital has just blown us away with the excitement that it has created.
So do you think that it's improved your dentistry, your clinical dentistry?
For sure, without question. And yes. What you don't actually realise is that at the time, you thought you were doing okay, but now you realise that you're doing it so much more accurately.
I think it makes you reassess actually your clinical skills, and it gives you that opportunity to do so, and it makes you a lot more, as you say, precise. And you know sort of now what you want to achieve, and you're able to actually check that you are achieving it. But also I think for myself it gives me a lot more fulfillment, and it's the enjoyment that I get a lot more, where it does just, you know, I do enjoy now going to work and enjoy the work that we're actually completing.
Yeah. Is it because you're seeing the dentistry is looking really aesthetic and it's really high quality standards?
I think it's just the fact that what you're able to achieve. It was a bit of a challenge, certainly, to learn the new techniques yes. and to use the new technology available. But I think once I achieved that, the contentment that you get, and the staff see it, the patients see it. So overall, the clinic, certainly in my case, is a lot more enjoyable.
Well, I think the journey for the patient has just become so much more inclusive. I mean, it's a much more emotional experience for a patient who can see work almost before they begin.
Yes.
At the stage that they will, guess when they're completed, they know immediately and what they're going to.
They like being part of it,
for sure.
They?
And the rapport that you build with your patient as a result of that automatically.
So, Uchenna, do you think that it's improved the communication?
I think hugely. I think one of the key things, listening to you talking, and I think as practice owners, we do tend to like being in control. And I think certainly for me that the aspect of digital is about the control. It's about that immediacy of seeing the result, of being sure that it's accurate, as you've kind of said, the communication with the patient, the involving the technician. So I think very much more it's kind of brought everybody together, so that we can make sure that we have a better outcome for our patients.
Excellent. You were mentioning some of the challenges. Do you want to tell us a little bit about the challenges and the steep learning curve?
Oh, absolutely. I mean, I only bought my CERAC actually about a year ago, 10 months ago then it actually arrived, and certainly the first couple of weeks I probably wanted to throw it out and then you just have to keep
Agreed.
with it. Yeah, and there's times I had to just sort of walk away. You sort of regained your train of thought, came back to it. You sort of know who to phone to help. So I think that's very important whenever you're setting out, is to have that backup there.
The backup and the training are so incredibly important, without
And then
question.
once you get that, and once you get those magnificent outcomes, then it is tremendous, and the feelings just are great.
What about the team support? You mentioned that your team enjoy it a lot.
Yes, I'm very lucky in that my team really encouraged me. So I think I came back from my first basic sort of training, and my nurse had booked me in 2 anteriors, so I was just
In the deep end.
terrified.
She'd done it ready before
so not
you
just
started
a
it.
nice wee simple posterior, 2 anteriors, and honestly, we did that in an evening. We made sure we had plenty of time, so I didn't overrun, I didn't have the pressures. So I think that's very important, is to make sure that you're not putting yourself under extra stress. And because my nurse had booked that in, you have to do it, and then you actually surprise yourself that you are able to do it, and the patient's so pleased.
So in terms of time, how long would you book for those? For the first time, how long did you book for those 2?
We booked
anterior
out
crowns?
first off, well, for that one it would have been 3 hours, and we definitely
From
needed
start
it.
to finish?
From start to finish. And we did definitely need it, because it's just learning about, of course you always have to change the burrs.
Of course. I
things
mean,
like that.
the things that can go wrong, they go wrong reasonably swiftly, and
Yes.
there's nothing like falling into a complete mess before you realise that, oh, well, that'll not happen again, because we know how to fix it the next time.
I think the troubleshooting's a lot faster as you go through the journey.
The more you do
Yes.
them.
Like-
Yes.
like-
Or when
Yes.
something fails and you have a patient who has arrived and all of a sudden the machine refuses to perform, and the stress levels can be quite acute at the start. But before long, you have troubleshooted and you configure your way around the machines.
Choose for the first number of patients, you choose the right patients.
Yes.
So they understand what you're trying to achieve, and they're not going to be the sort of patients that will certainly not be very happy with you.
So in terms of when things go wrong, you have a plan B. I'm just reading this excellent book, Cheryl Stanberg, about option B. So there is an option B. What would you say if your machine is not working?
You have to think very laterally and reasonably quickly.
Yes.
So very often, the fact that we have CEREC Connect with the CEREC system, it means you can simply scan and send it straight to a technician. Get help immediately and tell the patient that this time it's not going to work out. We have something that will be better designed if we send it away, and we still need our technicians so much from that perspective.
Yes, that's what I wanted to ask.
Yeah.
Because people think that if you have digital dentistry, you're not going to need a dental technician. What do you
No,
think,
I think
Uchenna?
the technician is just so important. Whether
Crucial.
from the
Crucial.
learning, because you remember dental school, the last time that we all waxed up teeth and that kind
That's
of
it.
thing. So I think you want your technician there with you from a
Supporting
point of
you.
view of advice and
Yes,
so on.
yes.
And I think the key things, yes, the technician. In a group like this, in a conference like this, you're meeting like-minded people. And I think anybody who's signing up to stuff like this has got a certain mindset. We're excited, you spent lots of money, you want to learn, so there's always support. But again, you alluded to your team. I think the team is so key. And I love what you said about your nurse, because they, help, it's okay, that kind of thing, they can
But
see
even-
what's going
more
on.
than you believe
But
yourself.
even the value that the new roles have brought to the team, the fact that they now can undertake so much more computer type work than they ever did before, apart from staining and glazing and so on, this new artistic role that none of them thought they were capable of, and all of a sudden they all have incredible new value
Yes.
in the work that they're actually doing from day to day. So the feel-good factor is quite immense on certain days.
I think if you involve somebody, then they will learn an awful lot more, and that's what we've found with our team. The fact that we involve each other, then we all learn together, and you can troubleshoot together. But going back to the technicians, I had an issue where I just could not, for the life of me, design this bridge. But Stephen Green's lab were able to actually connect remotely, design it for me, and I was still able to actually
on the
perform
spot.
and mill. So the patient still got what they wanted.
Well,
so that for me was just
from
fantastic.
the perspective of implant planning, I mean, that has been the main reason why I decided to invest in the first place, because all of a sudden I could see a way around creating a much quicker workflow for patients who are travelling perhaps, or they want to see it in advance but they would like the work done on the day, and when the situation is correct you can immediately load an implant. But to be able to do that all of a sudden has been a complete game changer.
Really?
You know, in terms of value for the practice, you know, the fact that they can go out and tell people, the excitement that they see when their own
Yes.
crown is being milled on the
Yes.
spot, you know, they want photographs taken.
Yeah, do they? Do they
Yeah.
take photographs? Yes.
So, you
And
know,
they tell so many people, they sort of
Yes.
brag about it, don't they, that they're part of this new technology.
So you're saying it's a big practice builder?
Oh,
The
for
patients
sure.
love it.
People
For
will
sure.
seek
Yes.
you out. They've certainly, again, I think within my first couple of weeks, somebody came to me because they could see it on our website,
Really?
and you do need to perform.
I think one of the things that is really important, and I love this kind of panel, is being real about what the learning curve
Yes.
is, being real about how long it's going to take. I mean, remember when we did cut our first crown, how long it took? And I think as dentists, we're perfectionists, and you know we need
that's
to.
also the lovely thing. The fact that your work is looking at you in huge magnification, you can see how, you know, rubbish or not
Yes.
rubbish your actual
You'll
prep
change
work
your
is.
margins.
You do.
You'll
You
get
can
your
change it.
angles right.
It means that
Yeah.
the lack of need for a digital or a regular impression automatically saves you time, the retake of impressions, the hassle that would cause the patient and yourself. Never mind, you know, time out of your actual appointment book. You know, all of a sudden, you know, you're cancelling all of those concerns out the second you take a digital scan. It's fantastic.
So the question that we wanted to ask is it worth it? Is it worth the investment?
I think the only regret I have is not buying it sooner.
Really?
Same
Yes.
as that. Same as
Yeah.
that. I think I was waiting for the golden moment, and as I say, when the golden moment was related to the fact that I could mill implants, all of a sudden I just knew it was time to go. My biggest regret is that is there some other work back there that I'll see repeatedly and wish I could change
Yeah.
things and have gone back to digital.
Yeah. I think like all things that you kind of adopt newly, you know, we're creatures of habit, so just taking that first step is the key thing. But
Yes.
as you do it and you get better at it, and realistically we just know that that you can't go backwards now.
That's
You
right.
can only
That's right.
move forward. So I would encourage people just embrace it. I
Yeah,
think you'd say.
absolutely.
Yeah.
It's the way forward. I just can't see any way around it, quite honestly.
Excellent, excellent. Well, I want to say thank you very much. Thank you so much for traveling and for being here today.
You're welcome.
It's been most informative, and we hope to see you again and have another one. So thank you so much.
Thank you.
Thank you.